honorable judges and members of the floor. I'm Mushida Hassan Bashri from UKM Medical Center. Today my topic will be demographic comparison of patients undergoing retinal surgery between two referral centers, showing indirect comparison between developed and developing countries. Common causes for referral to vitreoretinal surgeon includes rheumatogenic retinal detachment, tractional retinal detachment, vitreous hemorrhage, macular disease such as epiretinal membrane and macular hole, cataract surgery-related complications, and others such as drop intraocular lens, drop nucleus, endophthalmitis, and intraocular foreign body. Options for retinal surgery mainly are vitrectomy or sclerobuckle. A study by Yotson D showed that retinal detachment in the developing world is similar in many aspects to the RD in the industrialized countries. However, the presentation of RD in developing countries are more complex, which may require sophisticated surgery to reattach the retina. This is a retrospective analysis of the surgical data of a single surgeon working in University Kebangsaan Malaysia Medical Centre, Kuala Lumpur, and Royal Victorian Ear and Eye Hospital, Melbourne, Australia, from the year 2012 until 2017. Based on the data analyzed in Melbourne, about 408 cases underwent retinal surgery by a single surgeon from the year 2012 until 2013, and about 396 cases by the same surgeon in UKMMC, Kuala Lumpur, from 2014 until 2017. About 325 cases were included from Melbourne Centre, and 298 cases were included from KL in this study. In KL, the most common indication for vitrectomy was RRD, about 29% of the cases. This was comparable to surgery performed in Melbourne, about 30% of cases. Diabetic-related complication remained the second most common indication for vitrectomy for both KL and Melbourne, and other indications for retinal surgery such as cataract surgery-related complication, macular disease, and trauma were more or less the same between the two centers. As diabetic-related complication remained the second most common indication for vitrectomy for both KL and Melbourne, cases in KL were mainly of more severe form of disease where TRD accounts for about 18% of the cases, whereas in Melbourne, TRD were only 4% of their cases. Other indications for retinal surgery showed that in KL, the percentage is slightly higher for drop nucleus, drop IOL, and endophthalmitis. For the mode of retinal surgery, the most common retinal surgery performed in both centers were vitrectomy, and Melbourne showed higher percentage of sclerobuckle performed. There is no age from the data, however, we postulate that in Melbourne, patients present early with less complication of proliferative vitreoretinopathy or PVR. Unfortunately, this is a retrospective study, so the grading of PVR was not standardized. Majority of cases in both countries were macular off, and macular on is less in Kuala Lumpur. From our observation, retinal detachment is more chronic in KL, however, both centers did not compile the grade of PVR. For the lens status, majority of patients were phakic, going for retinal surgery in both centers. For gauge system, both centers use 23 gauge system more compared to 25 gauge system, and our data showed that Melbourne was still using 20 gauge system as that was the early transition time of small gauge vitrectomy. In UKMMC, during the same period of 2012 to 2013, UKMMC also had used the 20 gauge system. For macular surgery, in this study, surgery for macular hole and ERM were of balanced figure in Melbourne compared to KL, and compared to in KL, macular surgery for ERM is performed more than macular hole. Macular hole gives more acute and poorer vision, hence early presentation gives better prognosis after surgery. In KL, patients who presented late or chronic macular hole more than 1 year are less likely to go for operation. This table shows preoperative characteristic of retinal detachment in different settings compared to our study, and macular off was higher in the developing countries compared to developed countries where the rate was lower for the macular off. So for discussion, in our study, in KL, the most common indication for vitrectomy was RRD, and this was comparable to surgery performed in Melbourne. Diabetic-related complications remain the second most common indication for vitrectomy for both KL and Melbourne. However, cases in Kuala Lumpur were mainly of more severe form of disease. TRD accounts for 18% in KL, where Melbourne about 4% of the cases. In other study reflecting on the diverse nature between developed and developing nations, the pattern and attributes to patient undergoing retinal surgery showed that about 40 to 60% of patients in the Western had macula off, while the rate is 98% among the Indians. Despite the complex presentation, majority of eyes undergoing surgery for RD in a suitably equipped centers will regain useful vision, and anatomical success rate approach 90%. RD in the third world differs from RD in the industrialized countries in terms of genetic, ethnic variations, and environmental, which is geographic and socio-economic factors. Limitations for this study is retrospective data and different timeline. However, the strength of this study is that it is performed by a single surgeon, and both centers involved in these studies are tertiary referral center and with a similar number of cases. Suggestion for future studies to do a prospective study and similar time frame. And as for conclusion, in a developing nation, patients are more likely to present late, and complex detachment are relatively common. This may reflect the deficient state of local services and referral system, requiring re-evaluation to improve more on our service. Education and awareness to patients to present early plays important role, as awareness is a major issue in our country.